Hello, everyone. This is Sonisha, and today I'm going to talk about my master topic, which is depression, innovative treatments, and understanding. Depression is a silent but a very, very serious illness. It is so much stigmatized in our society that we often find ourselves disguising and denying from the fact that we might also have it too. I want to begin my presentation by engaging my audience in a small activity. Put your hands on your forehead and squeeze it until it starts to get really uncomfortable. That's how depression felt for me some time ago. Something that was always on top of my head, holding me back for no any reason. So, let's get started with the presentation. What is depression? So, oftentimes we tend to disguise depression as a bad mood, but it should occur to any common sense that bad mood doesn't persist for long. We need to understand that it is a mental disorder. You feel it very difficult to perform your everyday simple tasks and the ones that you enjoyed effortlessly. Depression brings persistent feeling of loneliness, sadness, suicidal thoughts, and feeling of unworthiness. You feel like you do not belong to a place. You feel like you're really useless and you do not have a purpose in life. It makes you lose your physical and emotional control. This makes it so hard to handle everything around us. So, know your signs and understand what is depression. As everyone says, it's a normal phenomenon that might occur to everyone. But even though it's normal to undergo depression, no one understands how vulnerable can one become after surrendering to this serious illness. If we closely follow the pattern, we tend to observe that depression also has a selected favorites among the general public. It occurs more to women than men, and particularly of the age group 14 to 25 years and 41 to 59. The people who have undergone depression and been exposed to stressful the people who have undergone and been exposed to stressful events in life, such as the death of a loved one, or maybe loss of a job, or maybe had a very bad childhood, and also there are certain personality traits that are more likely to be huge contributing factors for depression. Also, family history is very important factor to consider while talking about depression. Okay, it's time to ask some questions. Do you feel moody every time? Do you oversleep or maybe undersleep? And do you have a loss of interest in everyday life pleasures? Or maybe do you feel constantly guilty and hopeless about your existence? How about the social gatherings? Do you feel like withdrawing from all of them and just going into your own space in your own world and just getting comfortable with yourself only? That feels like a lot of questions shooting on you at once. But you should give it a try. Who knows? It can be you who is silently going through all this without knowing what is wrong. Hey, you. Yeah, it's time to get a self diagnosis. Now that you have understood few concepts about depression, let's peek into some helpful methods of what you can do next. It is always the best idea to calm down and compose yourself first. It's normal, but it's you who has to solve this because it's you who will suffer from this. So start by analyzing if there is really a huge load on top of your head that's holding you back every time. If so, then please seek some assessment to confirm it. Get the right kind of clinical diagnosis and deeply understand what is the type of depression that you are going through. The best way to start would be getting some expert consultation on what you are feeling, and you must be able to fully express yourself. Also, if you feel you have someone who is close enough to understand you, trust them and open up. because you need to take the first step. So, the therapies for depression. Talking about the therapies, psychotherapy, or commonly called talk therapy, is one of the very effective therapies. So, if you feel like there is something going on and something wrong with you, maybe you need to talk to someone. Believe it or not, but a human conversation has so many biological and psychological benefits. The human body, which is nothing but chemicals, gets positive arousal when we engage ourselves in a social activity or any type of conversation. Talk to someone in your family or your social circle or your friends or your colleagues with whom you can share things without having to put any filters to protect your self image or whatever. They can be a powerful resource for you to help untangle all the negativity that's just going on your head. If you do not have such person, seek some professional help, which is not a bad idea at all. They might be very, very helpful and make you feel a lot better too. The next kind of treatment would be the treatment with medications. If you feel like you are someone who cannot talk or who cannot communicate properly your feelings, then this might be for you. It is often understandable that people have variety of personality and some might not be able to do well in explaining themselves. So, so remember antidepressants are for you. These cannot be magical pills that would immediately pull you out of your situation, but they certainly can help you do better. They do have side effects, but what side effect could be worse than forgetting how to breathe and be cheerful in life? So, the next kind of therapy that we have for treating depression or a severe depression is electroconvulsive therapy, shortly known as ECT. So, don't be scared looking at all those wires and the things that is being surrounded on our head. Electroconvulsive therapy is used to treat severe depression and can help bring significant improvements in the mental health conditions. Electrical signals being passed to the region of the human brain, that is connected with the mood is what causes a change. While electroconvulsive therapy still remains to be stigmatized as that painful treatment in the eyes of general public, it certainly is the most helpful way to rescue a person from serious personal threats. When a person has undergone a serious stage of this illness, where self harm is very much a possibility, or when there is no time to wait for the miracles of antidepressant, electroconvulsive therapy can be of great use. Now, here are some useful tips from your side to tackle this illness because you needs you. Call it a self help or whatever you would like to call, but the first person who would help would be you. As it is framed here in my presentation slide, I call it as a seam method. You need to get enough sleep, at least 8 hours a day, and sleep can help cure a lot of different varieties of illness. It is very crucial to maintain a healthy diet and exercise well. Know well and understand what you are eating and what is going inside is what that radiates outside in you. Exercising well and maintaining a proper healthy routine is very much essential in life. This exercise rejuvenates the human body too and makes us feel energetic and more likely to be involved and fresh and be more productive. Engaging in any kind of social activity could be so much beneficial for your mental health. And also, do not forget to meditate. You got this and you can do it. So, in the end, I just want to assure you that however serious and scary depression might look and sound, but there is a cure to it. Only if you stop your hesitation and seek the right advice, you will be able to rescue yourself. So, it is very much important to serve yourself first. And no matter whatever others think about you, if they think that it is not your business to mind what others think, because self love is more important than all this stuff. Thank you for joining me in my presentation, and I hope this presentation was effective in some way to help you understand some concepts about depression. Thank you.